Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. I'm David Wyant, Chair of the Alberta Health Services Board, and I would like to welcome everyone to this physically distanced public board meeting telephone conference. Thank you for joining us. I would like to acknowledge the coordinated efforts of clinical and non-clinical teams throughout AHS that continue to protect Albertans while finding ways to deliver the care and services upon which we all rely. I would also like to thank Albertans for the sacrifices they made that helped limit the number of hospitalizations, including ICU visits, in the first few months of this pandemic. Their collective efforts helped ensure AHS had more than enough acute care and clinical care capacity as the virus spread throughout the province. We need Albertans to continue following public health guidelines during this relaunch period because the pandemic is not over and still poses a serious risk to public health. Prior to attending to the business of the meeting, I would like to speak about racism and intolerance. Or more accurately, I'm compelled to speak about them, as silence is not an acceptable option. This is not a south of the border or an elsewhere issue. It is an issue here in Alberta and here within Alberta Health Services. As Chair of Alberta Health Services, I want everyone to hear and understand this. There is no place for racism in AHS or our facilities. Indeed, there is no place for racism in our province, country, or anywhere else. I was personally outraged and disgusted when I learned about the racist slur and threat found earlier this month on a bathroom wall at the Drumheller Health Centre. Our board is pleased that management has responded quickly and comprehensively and is working with the RCMP to identify the person or persons responsible for this cowardly and racist act. We will continue to pursue this matter with urgency. We will also continue to provide supports to those impacted and shaken by the event. Racism and intolerance degrades people and their health outcomes. They also strike at the heart of what AHS aims to be, a learning, high-performing healthcare system that values diversity and inclusion. Compassion, accountability, respect, excellence, and safety are our organization's core values. And to truly live them, we will not permit this or any other future act of hatred or ignorance to go unaddressed. All Albertans, including our staff and physicians, should always feel safe and welcome within our facilities. And we expect patients, clients, and families to always be treated with respect and dignity. I would like to assure Albertans that we are taking action to stand against racism and intolerance wherever it exists in the health system. Now, before we receive the reports from the committees, I would like to address some administrative matters. As I mentioned, we are continuing to physically distance and are participating by telephone conference today. When I ask for a vote on a motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none or a minority who either oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
Hugh, I so move.
Thank you, Hugh. Will someone second the motion?
I will, Glenda.
Thank you, Glenda. Any further discussion? Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time?
Mr. Chair, Brian Vasjo here. I would like to declare a conflict of interest in respect of item 2B2, contract amendment with NMAX Energy. I'm employed by a competitor of NMAX and am therefore conflicted to participate in the vote.
Thank you, Brian. I ask that the corporate secretary ensure that the conflict is noted in the minutes. Are there any other conflicts? Hearing none, we will move on. You have all seen the minutes from our meetings of February 27th, March 18th, April 9th, and May 21st, 2020. Are there any corrections, issues, or questions? May I ask that someone move approval of all sets of minutes that have been circulated?
I'll move approval of minutes. Heidi?
Thank you, Heidi. Sorry, was that someone seconding it? Stephen?
It's Stephen. I second it. Yes.
Great. Thank you. Any further discussion? Any opposed or abstentions? The motion is carried. Thank you. We will now move on to the reports and motions from our board committees. Our first report is from the Finance Committee. It will be presented by David Carpenter, Chair of the Committee. David?
Thank you, Mr. Chair. The Finance Committee met on May 15, June 16, and June 24, 2020. As Chair of the Finance Committee of the Board, I am presenting 6 motions for approval today. First, the committee considered the amended and restated shared services agreement between Alberta Health Services and Alberta Precision Laboratories Ltd. Given the commitment value under the agreement exceeds the AHS President and CEO's limits under Policy 1100, Delegation of Authority and Establishment of Controls for Commitments, the Alberta Health Services Board is requested to approve the agreement. Additionally, as the commitment value exceeds the Alberta Precision Laboratories Ltd. Board's limits, Alberta Health Services, as shareholder, is requested to also approve the agreement on behalf of Alberta Precision Laboratories Ltd. The Board has considered such recommendation, and members support its approval. Accordingly, I move that the Alberta Health Services Board approve the amended and restated shared services agreement between Alberta Health Services and Alberta Precision Laboratories Ltd. on behalf of Alberta Health Services and as shareholder of Alberta Precision Laboratories Ltd. with such non-substantive changes as required by management, and delegate authority to the President and Chief Executive Officer to execute the amended and restated shared services agreement on behalf of Alberta Health Services and Alberta Precision Laboratories Ltd. in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. I so move.
I second.
Thank you, David. Thank you, Stephen. Any further discussion? Any opposed or abstentions? The motion is carried. David, please continue.
The committee reviewed 2 contract amendments that require board approval in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. The first was an amendment to the Villa Marguerite Seniors Community Partnership Master Services Agreement. The committee recommended board approval. The board reviewed the proposed amendments, and the members support the approval. Accordingly, I move that the Alberta Health Services Board 1 approve the amendment to Villa Marguerite Seniors Community Partnership Master Services Agreement on the terms reviewed by the Finance Committee and the Board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And 2, delegate authority to the President and Chief Executive Officer to execute this amendment on behalf of Alberta Health Services in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. I so move.
Thank you. May I have a seconder?
I'll second. Heidi?
Thank you, Heidi. Any further discussion? Any opposed or abstentions other than Stephen Vadjo, who's already gone on record? Okay. The motion is carried. Thank you. Please continue, Dave.
The second was a contract amendment with NMAX Energy Corporation, and that may be the one that
Brian. My apologies.
Vasjo wants to abstain on. The committee made such recommendation, and the board has considered such recommendation, and the members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the amendments to the current contract with NMAX Energy Corporation to add and remove sites and to renew the contract for a one-year term, and with such non-substantive changes that management of Alberta Health Services considers necessary or advisable, and B, delegate authority for the President and Chief Executive Officer to execute this renewal and amendment in accordance with Policy 1100, delegation of authority and establishment of controls for commitments. I so move.
Thank you, David. Will someone second the motion?
Hugh, I'll second the motion.
Thank you. And as David correctly pointed out, this is the motion on which Brian has abstained. Are there any other abstentions or oppositions to the motion? The motion is carried. Please continue, David.
The next motion is with respect to the fourth quarter 2019-2020 investment report. As mandated by Alberta Health Services Investment Bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of Alberta Health Services investment portfolio on a quarterly basis. The committee was presented the fourth quarter 2019-2020 investment report and recommended the board ratify the transactions. The board reviewed the recommendation. Accordingly, I move that Alberta Health Services Board ratify the investment portfolio and transactions described below and is certified by signed investment compliance certificates from Alberta Health Services and Phillips Hager and North Investment Management. A, as at March 31, 2020, AHS held restricted and unrestricted funds managed by Phillips Hager North Investment Management and Manulife Financial totaling $0.891 billion. B, funds are invested in short-term treasury bills, federal, provincial, municipal, and corporate fixed income bonds, pooled mortgage funds, bond funds, real estate funds, Canadian and global equity funds. And C, all the funds invested during the quarter ended March 31, 2020 were invested in accordance with the investment bylaw and investments policy as certified by signed investment compliance certificates from Alberta Health Services, Phillips Hager North Investment Management. I so move.
Thank you. May I have a seconder?
Brian Vazjo, I'll second that motion.
Thank you, Brian. Any further discussion? Any opposed or abstentions? The motion is carried. David, before I ask you to go on, just so that we can clearly hear everyone, if you're not speaking, please put your microphone on mute. There was a little bit of background noise there. Thanks. Please go on, David.
The committee considered an authorization to spend for AHS from April 1, 2020 to September 30th, 2020. On March 18, 2020, the AHS Board approved an interim spending authorization for the period April 1 to June 30th, 2020. Approval of the 2020-2021 budget for AHS by the Minister of Health is now not expected until September. In the meantime, AHS continues to keep Alberta Health informed of AHS' challenging financial position exacerbated by COVID-19 costs and continues to work on savings and revenue opportunities, including the AHS Review Implementation Plan due in August to improve AHS financial sustainability. This request for authorization to spend in absence of an approved budget is in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments, which provides that it be supported by written confirmation from the Minister's Office specifying the interim period and the amount of funding to be provided. The committee has recommended that the Board approve the authorization for expenses, and the Board has considered such recommendation and members support its approval. Accordingly, I move that the Alberta Health Services Board authorize AHS to incur 1. Maximum expenses of $8.15 billion for the period April 1, 2020 to September 30th, 2020, and 2. Maximum capital expenditures of $332 million for the period April 1, 2020 to September 30th, 2020. I so move.
Thank you. Will someone second the motion?
It's Glenda here. I'll second that.
Thank you, Glenda. Any further discussion? Any opposed or abstain? The motion is carried. David. think your last one.
The
For
committee
Finance
then
Committee.
considered Alberta Health Services transition to Alberta Investment Management Corporation as its investment manager in accordance with Section 2.41 Investment Management Services of the Regional Health Authorities Regulation. The committee recommended that the board approve the transition. The board has considered such recommendation, and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve A, the appointment of Alberta Investment Management Corporation as Alberta Health Services Investment Manager in accordance with Section 2.41 Investment Management Services of the Regional Health Authorities Regulation, and B, management agreement between Alberta Health Services and Alberta Investment Management Corporation based on the terms and conditions reviewed by the committee with such non-substantive changes management considers necessary, and delegate signing authority on behalf of AHS to the President and Chief Executive Officer. I so move.
Thank you.
I second.
Thank you, Stephen. Any further discussion? Any opposed or abstentions? The motion is carried. Thank you. Next, we have a report from the Audit and Risk Committee. It will also be presented by David Carpenter, Chair of that committee.
Thank you, Mr. Chair. The Audit and Risk Committee met on May 15, June 16, and June 24, 2020. Standard practice is that the Office of the Auditor General and KPMG are guests at each meeting in their role as external auditors of AHS. On May 15th, the committee reviewed the 2020-2021 Internal Audit and Enterprise Risk Management Department Plan and the 2020-2021 Continuing Care Audit Plan. On June 16th, the committee reviewed drafts of the annual report and the year-end financial statements, as well as an annual risk report. On June 24th, the committee received the Auditor General report for the year ended March 31, 2020. The committee received 4 items to consider for recommendation for board approval. The committee reviewed the 2020-2021 Internal Audit and Enterprise Risk Management Department Plan and the 2020-2021 Continuing Care Audit Plan. The Internal Audit and Enterprise Risk Management Department Plan outlines the audits and advisory projects to be conducted over the next year, which will focus on key organizational strategic priorities and risks. It also includes the department's goals, strategies, performance measures, and budgets. Continuing Care Audit Plan focuses on the planned routine and high-risk audits of continuing care services and programs across the province in the next year. The committee recommended that the board approve both plans, which were reviewed by the board. Accordingly, I move that the Alberta Health Services Board approve the 2020-2021 Internal Audit and Enterprise Risk Management Departmental Plan and the 2020-2021 Continuing Care Audit Plan in the forms reviewed by the board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. I so move.
Thank you, David. Will someone second the motion?
This is Heidi. I'll second it.
Thank you, Heidi. Any further discussion? Any opposed or abstaining? The motion is carried. Back to you, David.
The Chief Audit Executive reports annually to the committee on the adequacy and relevance of the internal audit's mandate, authority, and responsibility as defined in the Internal Audit Charter. The committee reviewed proposed changes to the Charter and recommended the board approve the same. Accordingly, I move that the Alberta Health Services Board approve the amended Internal Audit Charter in the form reviewed by the board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. I so move.
Thank you, David. Will someone second the motion?
Hugh, I'll second.
Thank you, Hugh. Any further discussion? Any opposed or abstaining? The motion is carried. David?
Final draft of the Alberta Health Services 2019-2020 annual report was reviewed by the committee, and it was recommended that the board approve the annual report. Accordingly, I move that the Alberta Health Services Board approve the Alberta Health Services 2019-2020 annual report in the form reviewed by the board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable, and B, authorize and direct management of Alberta Health Services to deliver the annual report to the Minister of Health and to later make the annual report available to the public through the Alberta Health Services website. I so move.
I second. Thank you, Stephen. Thank you, Stephen. Any further discussion? Any opposed or abstentions? The motion is carried. Thank you, David. Our next report is from the Quality and Safety Committee. It will be presented by...
One more, Mr. Chair.
Oh, I'm sorry. You just had so many today. Long day. Thank you.
Well, this other one's kind of an exciting one. So, the committee reviewed a final version of the March 31, 2020 consolidated financial statements, the establishment of reserves, and the financial statement discussion and analysis. The committee recommended the board approve those items. Accordingly, I move that the Alberta Health Services Board, 1, A, approve the internal restrictions as of March 31, 2020 of 1, $940.37 million to represent the amount of unrestricted surplus invested in tangible capital assets and not available for any other purpose. 2, $28.237 million to represent the amount of unrestricted surplus related to insurance equity requirements and not available for any other purpose. And 3, $54.139 million to represent the amount of unrestricted surplus related to foundations and not available for any other purpose. And B, confirm that all previously approved internal restrictions are replaced with the above. 2, approve the AHS-A consolidated financial statements for the year ended March 31, 2020, and B, financial statement discussion and analysis for the year ended March 31, 2020, both for inclusion in the AHS 2019-2020 annual report, and both in substantially the form reviewed by the board, with such non-substantive changes that management of AHS considers necessary or advisable, are hereby approved. And 3, authorize and direct management of AHS to deliver the consolidated financial statements and financial statement discussion and analysis to Alberta Health and to later make them available to the public through the Alberta Health Services website. I so move.
Thank you, David. We would not want to have missed that. Will someone second the motion?
Brian, I'll second the motion.
Thank you, Brian. Any further discussion? Any opposed or abstaining? The motion is carried. Thank you again, David, for all of your work. We will next have a report from the Quality and Safety Committee. It will be presented by Glenda Yates, Chair of the committee. Glenda?
Thank you, David. Quality and Safety Committee met on May 20th, 2020. The committee's meetings focus on access, quality, and safety. The committee received an update on the COVID-19 pandemic response with a focus on continuing care and long-term care. The committee also received a quarterly patient safety report, an update on the Alberta Surgical Initiative, and an update on medical staff appointments and privileging. As Chair of the Quality and Safety Committee, I am presenting one motion for approval of the board today. The committee considered revisions to the Quality Assurance Committee structure. All modifications to the AHS Quality Assurance Committee governance structure require the approval of the AHS board. It is proposed that the Queen Elizabeth II OB Quality Assurance Committee of the Queen Elizabeth II Regional Hospital Quality Assurance Committee title be changed to, and I quote, Queen Elizabeth II Maternal Child Quality Assurance Subcommittee of the Queen Elizabeth II Regional Hospital Quality Assurance Committee, end quote, to better represent the patient population served. It is also proposed that the Department of Medicine Calgary Zone Quality Assurance Committee be appointed to align with the scope of clinical departments represented by the committee, Calgary Zone Department of Medicine. Accordingly, I move that the Alberta Health Services Board approve 1, the name change to the Queen Elizabeth II Maternal Child Quality Assurance Subcommittee of the Queen Elizabeth II Regional Hospital Quality Assurance Committee as reviewed by the board, and 2, that the Department of Medicine Calgary Zone Quality Assurance Committee be appointed. I so move.
Thank you, Glenda. Will someone second the motion?
Brian, I'll second it.
Thank you, Brian. Any further discussion? Any opposed or abstentions? The motion is carried. We have reached the end of our agenda. Unless someone corrects me on that, I will declare the business meeting adjourned. Thank you, and again, please stay healthy.
Together, we do amazing things every day.